All right, 1, 2, 3.
Hi, I'm Sheri Rice, and we're here today to discuss the role of a certified registered nurse anesthetist. CRNAs administer anesthesia, they monitor vital signs, they're responsible for post-op recovery. They're in very high demand as they currently administer 60% of all anesthesia in the United States. The average program length for anesthesia for CRNAs is between 28 and 36 months for the master's degree program. The annual income for CRNAs is $165,000 a year. They are cost savings to the health care fund, including the Medicare Trust Fund, because they are compensated as about 50% of what insurance companies would pay an anesthesiologist. They do have a moderate level of stress. And next we have Denise.
Hi everyone, my name is Denise Michel. Today I'm going to talk about the certified registered nurse anesthetist. I'm going to talk about the years of experience required for this role. I'm going to talk about the education, the licensure, and also the certification. Years of experience. Most anesthesia programs require a minimum of 1 year of acute care experience, preferably in an intensive care unit or in an emergency room. Now the education. The very first step for an individual who is interested in becoming a certified registered nurse anesthetist is to earn the registered nursing credential through a hospital nursing program or via a 2 years or a 4 years nursing degree. To be eligible for licensure, graduate must pass the National Council licensure examination. In addition to a year of critical care experience, a prospective certified registered nurse anesthetist needs to complete a master's degree in nursing. Acceptance into a master's degree program typically requires to have a bachelor in nursing. After completion of the master program, receiving the designation of certified registered nurse anesthetist requires passing a certification examination. Now the licensure part. According to the official internet site of the Florida legislature, any nurse desiring to be licensed as an advanced practice registered nurse must apply to the department and submit proof that she or he holds a current license to practice professional nursing or holds an active multi-state license to practice professional nursing. And the last part is the certification. After graduating from an accredited nursing anesthesia program, graduate will need to take the national certification examination and must pass it to begin practice. Only the board may by rule provide a provisional state licensure of certified registered nurse anesthetist. Graduate required to continue their education by obtaining a minimum 40 hours of approved continuing education every 2 years. They have to document the practice and maintaining their state licensure. They also need to hold a current registered nursing license without a hold or pending record. They have to show proof that they have been engaged in the practice of anesthesia during the certification period. Verify they do not have any hold. They verify they do not have any mental, physical, or other problem that could interfere with the practice of anesthesia. Thank you.
Thank you, Denise. A job and responsibilities. According to Florida State Title 33, a certified nurse anesthetist may by authorized, established protocols and medical staff of the facility to which they are rendering anesthesia care may perform any or all of the following CRNA responsibilities. And the CNRA responsibilities are determining anesthetic patient care, Risk factors: determine anesthetic type with the physician consent, ordering pre-anesthetic protocol medications, and performing protocol procedures commonly used to render the patient insensible to pain during performance of various surgical, obstetrics, or diagnostic procedures. Other job responsibilities include supporting life functions and monitoring procedures, treating adverse anesthesia reactions and cardiac arrhythmias, managing post anesthesia care, and placing peripheral and venous, central, or arterial lines for blood sampling. The professional organization of CRNAs is the American Association for Nurse Anesthetists, the AANA, and their website is www.aana.com, and they provide a standard of standards for nurse anesthetists. And these standards, they offer guidance for CRNAs and healthcare institutions, help practitioners evaluate quality of care, and aid public understanding expectations and support of basic patient rights. And the standards of care 1, 2, 3, and 4 are concerned with documenting pre-anesthesia assessment and evaluation, obtaining and verifying informed consent for the anesthesia, and generally generating a specific anesthesia care plan, implementation and continuous assessment of patient response. Standard 5 is concerned with continuous monitoring, evaluating, and documenting of oxygenation, ventilation, and use of alarms, blood pressure, and heart rate every 5 minutes or more often if needed, thermoregulation, and positioning, and response to neuromuscular agents. And according to the AANA, continuous clinical observation and vigilance are the basis of safe anesthesia care. Standards 6, 7, 8, 9, 10, and 11, they are concerned with accurate and complete, legible, and timely documentation, checking and documenting alarms and equipment, infection control, anesthesia care quality, and transfer of care and basic patient rights. Cortina?
I'm Cortina Durant. As we all know, there is a national shortage of nursing in the United States. Currently, about 60% of states prove to have a CRNA shortage, but future trends show a surplus of about 8,000 CRNAs by the year 2020. Research shows no significant difference in the complications or mortality rates between a CRNA and anesthesiologists. Regarding healthcare reform, in response to Donald Trump's fiscal 2019 year budget, he has plans to cut significantly Title VIII funds. Programs under Title VIII help to build a supply of qualified nurses and healthcare needs. Title VIII funding has been critical to educating and training CRNAs. Surgical services is a major source of income for healthcare facilities. CRNAs allow them to continue to have those services available for a much cheaper price, as CRNAs get paid about half as much as it costs to be an anesthesiologist. It's a much more cost-effective way to carry out these services.
Thank you, Cortina. Legal issues for this role include many that are common to the practicing RN, and they are medical malpractice, breach of duty, injury, damage, and a failure to monitor, document, or follow standards of care, and failure to notify responsible physician. Another, a legal aspect, I should say, that is unique to nurse anesthetists is that the anesthesia record usually is the only continuous, contemporaneously prepared record of the entire operative procedure and can be best defense for you and your colleagues. Sheri?
Hi, today we've discussed the advantages, the educational requirements, the legal aspects, the roles and responsibilities of a certified registered nurse anesthetist, and we all believe that it is a degree worth pursuing. Thank you.
Thank you.
Thank you.
Thank you.